There is an old saying in Korea that your mouth will become twisted if you sleep on a rock pillow or on a cold floor. This is called facial paralysis. The number of patients increase when the weather becomes cold. And there are cases of facial paralysis when people are exposed to air conditioning during the summer. In Western medicine, there aren't any particular treatment methods because the symptoms are believed to disappear in 2 to 3 months. Because the disorder appears on the face, it changes the appearance, and the eyes, mouth, and other areas cannot function properly, causing great discomfort. Also, when not treated properly, there can be lasting side effects. Then how does Korean traditional medicine treat this? A Korean traditional medicine hospital in Seoul. 42-year-old Mrs. Chu is a Korean who lives in Nicaragua. She suddenly experienced facial paralysis 50 days ago, but she came to Korea because treatment was unavailable where she lived. Facial paralysis comes from fatigue and stress. She cannot move the right side of her face.
저요 위를 한번 떠보세요. 주름이 여긴 잡히고 여긴 잘 안 잡히지 아직은 마비가 덜 풀려가지고 여기 이제 요렇게 될 증상이거든. 뭐 곧 될 거예요. 이거는 곧 돌아온다고. 지금 나 조금 덜 났거든. 아주 심했었거든 지금.
Facial nerve paralysis is a disorder that suddenly causes paralysis on half of the face without any symptoms appearing beforehand. This disorder develops usually between the ages of 40 and 50, and especially when people are exposed to the cold winds that start to blow in the winter. Nowadays, younger people and even pregnant women can contract this disorder because of stress and overexertion.
처음에 제가 지금 외국에서 지금 이민가 살고 있거든요. 그래서 회사에서 근무하는데 밤에 잠 못 자고 머리가 그렇게 아프고 그래서 아침에 일어나고 나니까 입이 돌아가더라고요. 그래서 이제 거기서 치료를 좀 하다가 안 돼서 한국에 왔어요.
Korean traditional medicine has an abundance of experience because it has been researching facial paralysis from ancient times. Korean traditional medicine and Western medicine have different views on this disease. While Western medicine perceives this disease to be caused by a virus, infections, or inflammations, Korean traditional medicine perceives facial paralysis to be a type of wind stroke. When the mouth and the eyes deform, it is called facial nerve palsy or facial asymmetry.
일반적으로 중추성에 의해서 오는 마비는 뇌에 이상이 오는 거죠. 뇌 출혈이 왔다든지, 뇌 혈관이 막혔다든지. 그래서 오는 경우가 있고 뇌 종양이 있다든지 이래서도 올 수 있죠. 그 다음에 이제 말초성 마비란 것은 바로 조금 전에 설명했지만 풍사가 들어와서 왔다. 갑자기 이제 자동차를 타고 갈 때 창문을 열고 차창 밖으로 얼굴을 갑자기 내밀었을 때 바로 그 순간 입이 돌아가 버리는 경우도 있고 그 다음에 일반적으로 이야기하면 여과성 병원체 바이러스가 감염돼서 돌아가는 경우가 있다. 그런 예는 감기 후유증, 감기를 오래 앓거나 감기를 앓는 과정에도 올 수 있습니다.
Facial nerves are not only responsible for facial expressions, but also affect sight, saliva secretion, tearing, and hearing. So malfunction of the facial nerves can cause impairment to these functions as well. One Korean traditional medicine hospital did an evaluation on 500 patients who sought treatment for facial paralysis. There were many patients that sought treatment for other related disorders as well. If facial paralysis patients were categorized by age, most of the patients were in their 40s. However, the stress and strain from living in today's society is causing the number of patients in their 20s and 30s to increase. The best method to diagnose facial paralysis is infrared body heat diagnosis. The severity of the disorder can be determined by heat distribution on the face. This is helpful during the treatment procedure because the rate of facial nerve restoration can be predetermined. The most important factor in the body heat diagnosis of facial paralysis is the even distribution of heat on both sides. Heat is distributed asymmetrically on the faces of facial paralysis patients. Paralysis occurs in the areas where it appears cold. The blue-colored areas, which signify paralysis, become red in color as the treatment progresses. When the color on both sides of the face are evenly matched, it is a sign of full recovery.
예, 적외선 체열 사진을 통해서 앞면에 와 있는 혈액 상태를 저희 검사하게 되는데 두 가지 경우가 있습니다. 온도가 마비되어 있는 쪽이 높은 경우가 있고 또 낮은 경우가 있는데 높은 경우는 저희가 우려됐다고 얘기하거든요. 병의 원인이 대개는 귀 뒤쪽의 앞면 부위로 혈액이 많이 와서 맺혀 있는 경우를 얘기합니다. 이런 경우는 맺혀 있는 기운을 풀어주는 치료를 하게 되고 또 대부분은 낮은 경우가 많이 있습니다. 풍환성이라고 얘기하는데 찬데 노출되거나 해서 오는 경우는 낮아 있는 경우가 많이 있는데 이런 경우는 이제 기운이 잘 갈 수 있도록 하는 치료를 하게 되죠.
Facial paralysis can also be detected through blood tests. Korean traditional medicine views proper blood circulation to be a sign of good health. Clotting of the blood is the beginning of various sicknesses. A healthy person's blood cells are of round and standard shapes. However, the blood cells of a facial paralysis patient are misshapen. Toxins are visible within the blood, or the leukocytes are clotted. Facial paralysis is the result of bad energy flow during this condition. In Korea, acupuncture has been applied to the Chichang point at the ends of the lips, the Hyupgo point under the chin, and the Yepung point behind the ear in order to treat facial paralysis from centuries ago. It is also effective for facial paralysis to apply acupuncture on the Choksam point located beneath the knee. The Taechung point located above the instep of the foot is beneficial for facial paralysis caused by stress. Surprisingly, this form of treatment is in agreement with the newly revealed information on facial nerve development put forth by modern medicine. The most effective treatment for disorders caused by low body heat is moxibustion. This is a Korean traditional medicine treatment that chases away external cold temperature by giving heat stimulation to the meridian points. Moxibustion is not applied directly to the face simply because a patient suffers from facial paralysis. Moxibustion is applied on the stomach because it sends heat to the stomach and the intestines. These are connected to the meridian system and the face, so it will ultimately draw the cold temperature from the face. The heat relayed through moxibustion unclots the blood and increases energy circulation.
일반적으로 이야기하면 여러 가지가 포함됩니다. 혈액순환도 되고 찬 곳을 덥게도 해주고 심위경락을 하나 일반적으로 사이클입니다. 사이클이 잘 돌도록 해줌으로 인해서 문제가 있는 취약 부위가 정상으로 이제 돌아오는 거죠. 그래서 이 중앙과 단전 쪽에 뜸을 떠줌으로 인해서 모든 인맥과 연관되는 기관이 다 좋아집니다. 특히 이제 중풍도 좋아지고 심장도 좋아지고 특히 구안화사 같은 안면 쪽의 마비는 아주 재밌는 아주 효과를 볼 수 있고 임상적으로 지금 우린 많은 환자를 통해서 효과를 많이 보고 있습니다.
There are over 7,000 nerve tissues in the face. The various nerve tissues send electrical stimulation to the facial muscles. This is responsible for all the various expressions we create, our tears, and our saliva secretion. Facial paralysis comes about when there is damage to these nerve tissues. One treatment method commonly used is stimulating areas with delicate levels of electricity. Not only will electrical stimulation or PAC applications help alleviate the symptoms to facial nerve paralysis, but these can also lessen the pain caused from this disease. In severe cases of facial paralysis, symptoms can last for 6 months.
그날 그 몸 상태에 따라서 한약도 조제가 틀리시고, 그래서 그런 믿음이라든가 그날의 상태에 따라서 그 진맥을 보시고 침도 그 다르게 놔주시고, 그러면서 마음 신경성 안정시키면서 또 여기 입 돌아간 거에 대해서 이렇게 놔주시니까 하루하루 근육이 조금씩 이렇게 움직여지고, 그 물리치료도 이렇게 안마, 마사지 같은 것도 잘 해주셔가지고 이렇게 빨리 이렇게 근육이 돌아오는 것 같더라고요.
Another Korean traditional medicine hospital. 36-year-old Mr. Jung, who we met here, was shocked 5 mornings ago when he couldn't move his mouth and eyes properly.
눈물 처음 흘린 게
He had suddenly suffered from facial paralysis.
그려져 있고 안면부도 온도가
Sleeping in a cold room seems to be the root of the problem.
제일 낮은 온도가 올라오면서 높은 온도인데
During a weakened state, cold entered the body and caused paralysis to half of his
이걸
face.
넘어가면 이게 중수성이라 그래요.
Stiffness and pain at the back of the neck and behind the ear are felt when there is facial paralysis.
넘겨보겠습니다. 예.
Mr. Jung couldn't eat properly, and food accumulated inside of his mouth.
이해해보시죠.
When he tried to smile, his mouth would not contort because he had facial paralysis on the right side of his face.
한 번만 더.
He also lost his sense of taste.
습관들이 튀네요, 여기가 지금. 안면 부위에 기운이 많이 맺혀 있어도 문제가 되고 또 흐르지 않아도 문제가 되는데 이 많이 맺혀 있거나 흐르지 않는 것들을 침을 통해서 잘 통하게 만들어주고 또 안면 부위로 이렇게 갈 수 있는 기혈순환이 잘 될 수 있도록 목이나 턱관절 쪽에 문제가 있는 경우는 이런 경우는 추나 치료를 하게 되죠. 그리고 침을 놓고 난 다음에 근육을 잘 쓰기 위해서 이렇게 전침을 걸어주거나 물리치료를 통해서 늘어져 있는 근육을 탄력 있게 만들어주는 이런 치료를 하게 되고 약물 치료를 통해서 어혈을 제거하거나 찬 기운을 없애거나 허약한 것을 보호해주는 그런 치료가 같이 가게 됩니다. 그래서 추나나 침, 약물, 물리치료가 병행되는 것이 치료의 방법이라 볼 수 있습니다.
Acupuncture is known to have immediate and effective results in treating facial paralysis. This is why facial paralysis patients in Korea seek out Korean traditional medicine clinics. If facial paralysis is caused by the cold temperature, acupuncture is applied to the Sakjukgong point at the ends of the eyebrows, Chanjuk point near the eyebrows, the Hwaryo point above the upper lip, and the Sungjang point underneath the bottom lip. In the earlier phases of facial paralysis, stimulating the meridian systems with general acupuncture alone can be effective. However, if the disease is well underway, electroacupuncture is much more effective. Stimulating the related meridian points by delicate electric stimulation can restore the muscles and the nerves. Generally, the nerves of the paralyzed face can recover naturally, but there are also reports from one American doctor that 30% of patients do not recover. This disorder ultimately cannot be neglected.
만질 때 어떠세요, 여기 지금?
The neck and the jaw are connected to the face. Distortion of any of these parts can affect the flow of energy.
힘 빼시고 편안하게요. 예.
There are some facial paralysis patients who have abnormalities in the cervical vertebra or problems in the jaw joints. This was the case with Mr. Jung. The jaw joints were not properly located, so it added to the causes of facial paralysis. The most effective method is to use chuna therapy to hold the bones and muscles in place with the hands.
여기 잡고 저렇게
Apply pressure to the sides of the face with the palms of your hands to locate the bones of the face properly. Also, this can fix facial paralysis because it restores energy circulation moving toward the face.
안면마비의 경우에 경추나 턱관절에 영향을 받는 경우가 있는데 이런 경우는 기혈순환만 개선할 뿐만 아니라 이 모양의 문제, 형태의 문제를 가지고 있는 경우는 이 형태의 문제 때문에 기혈순환이 되지 않는 경우가 있기 때문에 목이라든지 턱관절에 문제 있는 경우는 추나요법을 통해서 바로 모양을 잡아주는 것을 얘기하죠. 그래서 비록 안면마비지만은 그게 목이나 턱관절 쪽에 영향을 받고 있는 경우는 추나 치료가 필요하다고 볼 수 있습니다.
In order to quickly restore the nerves of the paralyzed face, facial massage and other rehabilitation treatments are necessary. Even after nerve restoration, tiny signs of paralysis can remain, so you must massage your face diligently. Press the target areas of paralysis and use circular and rubbing motions. Massaging the areas with the hands by stimulating the points where acupuncture was applied is very effective. These are necessary methods to use for faster nerve recovery. For faster recovery, Korean herbal medicine used to be used to eliminate wind and to protect the organs. The ingredients to Korean herbal medicine differ depending on the cause of facial paralysis. Generally, cold energy causes facial paralysis, but sometimes it can be caused from moisture or heat. It is important to prescribe Korean herbal medicine after having diagnosed the cause of the paralysis accurately. The most common ingredient used in treating facial paralysis is Radix sopachnikoviae, which takes away cold energy. Romulus aduncus incare increases blood circulation. Rhizoma gastrodiae restores vital energy. Bombyx batriticatus eliminates the wind and heat and alleviates spasms. Radix linderae is used to aid energy circulation. When you mix these ingredients and boil them in water for a long time, it forms a medicinal treatment for treating facial nerve palsy. Its positive aspect is that it doesn't harm the stomach. "45-year-old Mr. Kim has suffered from facial paralysis 3 times already. From his past experiences, he was able to detect the illness early on and admitted himself to a Korean traditional medicine hospital. He went through intensive acupuncture treatment for 15 days, and already he is seeing results. Like this, it is important that facial paralysis is treated immediately. Mr. Jung's efforts are also impressive. He attempts making expressions in front of the mirror and exercises and massages his face to restore his paralyzed nerves. As a result, his mouth is no longer contorted.
한 20일 동안 스트레스 받고 그래서 좀 스트레스 받고 했는데 목이 좀 뻐지근해서 안 좋다 생각하고 있는데 나는 어렸을 때 해왔던 게 있어 놓으니까 이 아팠던 게 있어 놓으니까 항상 이 조심을 하고 다니는데 딱 오더라 이 말이에요. 그래서 저녁에 밥을 딱 먹는데 입이 돌아가는 느낌이 안 좋아서 거울을 딱 봤더니 돌아갔더라 이 말이에요. 그래서 저녁에 자고 바로 아침에 이 병원으로 좀 들어온 거예요. 그랬더니 여기서 침 맞고 치료하고 좀 약 먹고 했더니 목 뻐지는 게 좀 없어지고 입이 좀 어느 정도 돌아왔고 그런 지금 이제 좋아지는 편이에요.
The effectiveness of Korean traditional medicine treatment in treating facial paralysis has only recently been clinically proven. In this particular Korean traditional medicine hospital, 75% of the 500 facial paralysis patients recovered to normal within 2 weeks. In severe cases, they were healed in 2 months.
신경을 썼다는 것은 이유는 되겠지만 또 신경을 쓰지 않고도 과로하거나 피곤할 때 뒷골 좌측이나 우측이 주로 이런 쪽 귀 뒤 여기가 뻐근한 걸 느끼고 쑤시는 걸 느낍니다. 이렇게 어떤 몸에 평소에 이상을 느끼고 계신 분들이 거기 올 때는 쉽게 어떤 마사지요법, 소금물 같은 걸 약간 짭짤하게 타서 따끈따끈하게 끓여가지고 수건에 적셔가지고 이게 통증을 느낀 부위에 일단 혈액순환이 안 되고 대사가 안 되니까 이렇게 찜질해주죠. 아주 뜨거운 물수건이 아닙니다. 따끈따끈한 걸 이렇게 좀 대주시고 그리고 벽열을 낮춰야 됩니다.
Facial paralysis does not come about without forewarnings, but in the midst of our busy lifestyles, it is easy to overlook them. We are taken aback only after discovering our faces contorted after waking up one morning. Fortunately, Korean traditional medicine offers highly effective treatments. However, we must keep in mind that if the treatment is undertaken with indifference, there can be long-term paralysis and lasting consequences. Our health lies in our hands. The hands are the windows to all the body's organs. This is where all the meridian systems pass through, so health management is possible by concentrating on these areas. There are methods to maintain our health by managing our hands. Koryo hand therapy is one of the health methods known worldwide today. Korean-developed Koryo hand therapy was selected as a tourist commodity for overseas tourists. Interest in Koryo hand therapy is increasing daily, regardless of sex or age. Anyone can apply acupuncture after initial training because there aren't any negative side effects from hand acupuncture. Some of its benefits are that it is easy to learn. It can be applied anytime or any place. And self-application is possible. The needles used are smaller than common acupuncture needles. Also, other items like moxibustion and sharp prismatic needles can be used. Let's find out how we can prevent facial paralysis through hand acupuncture. First, apply acupuncture at the ends of the middle finger. This area is directly related to the nerves of the face. Acupuncture applied from the ends to the palm of the hand can treat abnormalities of the heart, kidneys, and the stomach that can cause facial nerve palsy. Before applying hand acupuncture, you must relax the muscles in the hand that is tense. Next, find the corresponding points by pressing the area that is painful. Of course, you must sterilize the needle to prevent infection. Hand acupuncture has immediate results, so it is often used to treat less severe disorders that require quick treatment. This is helpful for facial paralysis by relieving the areas of paralysis around the mouth and the eyes. Moxibustion is effective in treating facial paralysis when energy weakens and the body becomes cold. Moxibustion restores heat and warms the body. Apply moxibustion on the points in the same order that hand acupuncture was applied and burn it for 30 minutes. The most convenient item in Koryo hand therapy is the needle. All that is needed is to attach a flat needle with tape to the point. This consistently stimulates the points and increases the benefits of the treatment. The hands. They can extend longevity. The secret of longevity does indeed lie in our own very hands. Anyone can learn acupuncture, so let's practice it and keep healthy.